the sixth year, Missouri KidsFirst is presenting the Standing with Children Awards to recognize and honor individuals who have made it their life's work to consciously choose to prioritize children and make significant contributions to advancing the protection of children from abuse and neglect in Missouri. I would like to thank our sponsors for today's event, including Children's Mercy Hospital and Clinics in Kansas City, Missouri's Children's Trust Fund, Central Bank, the Family and Community Trust, and the Children's Advocacy Center of East Central Missouri, a division of CompTree. We are especially grateful to our sponsors who, despite the changes in our event, are committed to the ongoing work of Missouri KidsFirst. It is my pleasure today to welcome you and thank you for coming. We recognize the extraordinary changes that we have all experienced in our lives over the past 6 to 8 weeks due to the COVID-19 pandemic. It still seems dreamlike that we are hosting today's event virtually, and rather than enjoying a delightful gourmet luncheon together, we are all in our homes eating peanut butter and jelly. We're all in uncharted territory. As we proceed through today's event, you are invited to type messages and comments and questions for our awardees and for Missouri KidsFirst into the chat function at the bottom of the screen. We will follow up with you after today's event to respond to comments and questions. We thank you for participating. Whenever I think about this time of social distancing, I always think about the thousands of children in our state who are experiencing the isolation and emotional distancing that occurs because of abuse and neglect. At this period of business, at this time of business closures dragging on and unemployment growing, the extreme financial and emotional stress for adults can reach a breaking point, and the risk to children for experiencing abuse and neglect gets higher and higher. Our work to end child abuse and provide training and support to professionals providing direct service to child victims becomes even more important at times like this. As a nonprofit organization, Missouri KidsFirst's core beliefs are only adults can prevent children from abuse and neglect, and it's every adult's responsibility to do so. This means that if we want to keep children safe, we must make sure that adults have the knowledge, skills, and understanding required to act on behalf of children. It takes a lot of courage to stand up for the safety and well-being of children. And that is why it's important to Missouri KidsFirst to recognize some advocates who have chosen to use their personal power and relentless compassion to put the well-being of children first. I'm pleased to introduce my colleague, Jessica Seitz, our Director of Public Policy at Missouri KidsFirst, to speak about our public policy work and recognize today's first Standing with Children Award recipient.
Hello, everyone. This Monday in April is certainly different from most Mondays in April for those of us in the public policy world. In normal circumstances, we would be running around the Capitol, preparing to testify for hearings, trying to work with lawmakers, make sure those in the last final weeks of session that are, all the language is correct in the bills that we're advocating for. Yet, instead, our advocacy is occurring at home. However, today, actually, the Missouri General Assembly is coming back after several weeks off today. And so we're going to begin with our first award because Representative David Wood is actually here joining us, but he is going to have to probably leave in a few minutes because they are convening as we speak. So I know that there are many friends on this webinar today, but for those of you who are less familiar with our work, in a minute, several of my colleagues are going to talk about the different programs Missouri KidsFirst coordinates as the state chapter of Child Advocacy Centers and Prevent Child Abuse Missouri, and the coordinating body for our Safe Care Network. But all of this work, the work of our Child Advocacy Centers, our multidisciplinary teams in Safe Care, is all possible because of systemic advocacy. And Missouri KidsFirst work to educate policymakers to ensure that they have the knowledge and understanding required to advocate on behalf of children who have experienced or are at high risk of experiencing abuse or neglect. Our mission is to empower adults to protect kids. Legislators and agency leaders, they are very much part of that group. So Missouri KidsFirst, we advocate at the state and federal levels, which, like I said, we work to cultivate champions in Jefferson City, track and draft bills and amendments, and testify in hearings, engage in meetings every day during session and in the legislative off-season. Over the years, we have diligently worked to improve the way that Missouri's legal system responds to issues of child abuse and neglect. And we've got a pretty good track record over the years. This has included both securing and increasing funding for Missouri's Children's Division and Child Advocacy Centers and the Safe Care Network. We've worked on legislation and policies surrounding the way that mandated reporters report suspected abuse and neglect to our Children's Division, and increasing penalties for child abuse crimes, and much more. We've got a full agenda every session. So, but all of this work and this number of hours from Missouri KidsFirst and our membership works to fulfill our vision of a consistent, high-quality statewide response to child abuse and neglect, providing all children with access to the necessary health and social services to allow them to thrive. So I'm going to give you an advocacy story that will really shine some light on what it's like to cultivate and have a legislative champion. So a few years ago, the Federal Commission, this is a great story and it's pretty moving. A few years ago, the federal government released a report, the Federal Commission to Eliminate Child Abuse and Neglect Fatalities. And it has a lot of recommendations, but all of the recommendations, what they really highlighted was the need for infants and toddlers that they are at increased risk for serious injury and fatality resulting from abuse and neglect as a result of their physiology and high level of dependence on their caregivers. Key to the high number of recommendations, one of the top recommendations was improving a coordinated effort and a well-coordinated effort and the involvement of specifically trained healthcare providers in investigations of child safety. Healthcare providers are better able to identify those low-level injuries that can be indications of increased risk of fatality in our young children. So by involving providers, we increase the chances that safer decisions will be made by child welfare workers to protect kids from fatalities, child abuse and neglect fatalities. So we took this recommendation, we didn't wait on the feds, we got to work here in Missouri. We started thinking about solutions and how to implement this recommendation in our state. So we leveraged our longtime partnerships. We relied on the expertise of the Child Abuse Resource Centers here in Missouri. So at St. Louis Children's, Cardinal Glennon, and Children's Mercy, we came up with some very easy recommendations, such as involving safe care providers in investigations concerning children under 4, training our Children's Division investigators in the medical forensics of child abuse and neglect, and referring cases to juvenile courts when a provider has in fact diagnosed physical abuse in kids under 4. So these recommendations became House Bill 1877, sponsored by Representative David Wood. In record time, this bill was introduced in 2016 and passed in 2016, if you can believe it. And since that law's passage, the number of safe care referrals increased dramatically, which exceeded the capacity of our providers. That next year, child abuse pediatricians at our resource centers reviewed over 7,000 cases using a triage system. This required advocacy for increased resources. So that next year, we went back to Representative Wood, who happens to serve as the chair of the Appropriations Subcommittee on Appropriations on Social Services, Health, and Mental Health. And we worked to secure a line item to implement a regionalized medical response to child abuse, which included support for the medical review of these cases for children under 4 by our safe care providers. So that was in 2017. It's pretty remarkable, but believe it or not, that line item has been maintained in 2018, 19, and hopefully 2020 has been recommended. We are incredibly grateful because that is in large part because Representative Wood has maintained his commitment to protecting our youngest, most vulnerable children from abuse and neglect. So this story is pretty powerful, and this is just one reason we're very, very proud to recognize Representative David Wood with a Lifetime Standing with Children Award today. So just a bit, that was one story, just a bit about Representative Wood, and then I'm going to allow him a few minutes to make some remarks. So Representative Wood has represented Morgan County and parts of Montauk and Miller counties for 8 years in Missouri House of Representatives. He chairs the Subcommittee on Appropriations for Health, Mental Health, and Social Services, serves on several committees, including Vice Chairman of the full House Budget Committee. During his time in office, Representative Wood has been a champion, a true champion for protecting Missouri's most vulnerable kids. In addition to 1877, which I just shared, his legislative achievements include improving safety for children in childcare, enhancing the central registry to include people convicted of additional violent crimes. And finally, during his time in office, Missouri has faced nothing but fiscal challenges and challenging fiscal environments. That's to say the least. We believe that even in tough budget times, children should be a priority, and Representative Wood agrees with that. In these very tight fiscal times, he's vigilant in his quest to make sure that Missouri continues to invest in the safety of our kids. And he's been a steadfast supporter of investing in the workforce of our children's division in particular to address problems of high turnover and high caseload. In Missouri, it's really hard to share that we have term limits, and this will be his last session in office. He has served the full 8 years, and we are very sad to see his time in the House come to close. But know his commitment to the safety of our kids is ongoing, and we look forward to working together in the future. So I will say, as the policy director at Missouri KidsFirst, in closing, there is one word I would use to describe David Wood from my very first meeting with him in First Sales, right after I joined the team. It is accessible. His door is always open, and his phone is always on. Even on a cruise ship, during the legislative off-season, when he gets a frantic phone call from an advocate worried about funding, he is quick to answer and quick to take action for our kids. Thank you, Representative Wood, for standing with Missouri's children.
Thank you, Jessica. You make it sound like this is a very tough job and like I've accomplished a lot of things. I don't feel that way at all. I feel that I had a priority when I started this job that is, I'm getting a message on my computer. Hopefully you're still able to hear me. It's one of those things that I have priorities. Children happen to be one of my top priorities because no child ever asked to be in a home where he was going to be or she going to be abused. We have to take care of the people who have no ability to take care of themselves. So my priorities was to make sure that the legislation that we passed, the funding that we had, was going to do everything we possibly could for the children in the state of Missouri. I tried to avoid cuts in any way to Children's Division and into any program that would affect the health and well-being of our kids. It's going to be very difficult to do that. Today, if you heard the annoying buzzer a little bit ago because my computer was unmuted, that means I'm supposed to go to the floor and pass a budget for 2021. We've got huge shortfalls due to the COVID-19. We're trying very desperately to keep all the programs intact that we possibly can. There will be some hurt to Children's Division. From what I've seen, it shouldn't be too terribly detrimental yet. And we still have the hope of federal money coming in that we can supplant and put some of that money back. So we will be diligent in how that money is spent and take care of those that really need the help. I want to give a lot of credit to Emily Van Chenkoff, the former legislative director for Missouri KidsFirst, and to Jessica. They are in my office all of the time, and I thoroughly enjoy their friendship, but more importantly, I appreciate their advice and guidance on a lot of these issues. Yes, I am the voice on the floor. Yes, I'm the voice in committee. I work with the relationships trying to get this legislation passed. But the reality is most of it comes from the advocates in the children's organizations like Missouri KidsFirst. So when I attend meetings and I get to wave my little pinwheel and be recognized, I don't feel like I have done the work. I feel like you have done the work. And I appreciate everything that the children's organizations across the state do to protect children and make sure that they're safe. And with that, we've got to be even more diligent coming out of this COVID-19 pandemic, because we have confined children into homes that are not in the best shape. We've confined them with parents who are struggling with finances, who are having all kinds of issues with work. And when you put an additional stress on the parents in a very dangerous situation for the children, it just makes it worse. Then you have no way of viewing these children because they're not attending school. They're not getting out of the house to where people can observe these situations. So I feel in fear as we starting to open up the state that we're going to find many cases of abuse that we're going to have to take immediate action on. And that means a lot of work on your behalf, on Children's Division's behalf, and supporting all of these people working in this very critical area. Thank you for the recognition. I do feel somewhat melancholy that my 8 years is up, but I knew that the start of my term that this was going to be the finality of it. I do not want to end my work in serving the state of Missouri. I don't have a position I can run for in a political office, but I will hope to find a job somewhere that I can still benefit, especially children in the state of Missouri. Thank you very much for this recognition. Thank you, Jessica, for the kind words and the hard work that you do, making sure that the policies that we pass every year are what's best for Missouri's kids. Now, my apologies that I do have to leave the meeting because they are waiting up on the floor to work on this budget. Don't get too upset when you see the budget come out. Know that there's going to be more funding coming on, a special session later on, I'm sure, to work on some of the budget shortfalls that we've got. But we have to get a budget passed by our constitutional obligation, and we have to have something to operate on July 1. So that's the reason we're doing it. Yes, it's going to hurt in places, but hopefully we can fill that back in soon. Thank you again.
Thank you, Representative, and Godspeed. Good luck. All right, I'm going to turn it over to my colleague, Jenny Sommerfeld, and she's going to present our next award. Thank you, Representative Wood.
Hey, everybody. Hopefully you can hear me okay, and thanks so much for being with us here today. As Joy mentioned, Missouri KidsFirst mission is to empower adults to protect children from abuse and neglect through community education, professional training, and child advocacy. One of the primary ways that we fulfill this mission is through the training and support that we provide to our member child advocacy centers. Over the years, Missouri KidsFirst has grown a robust training program for the various disciplines represented in the child abuse investigation that include both basic training and continuing education for forensic interviewers, victim advocates, child protection workers, and medical providers. We also strive to connect law enforcement, attorneys, mental health care providers with critical training opportunities to ensure comprehensive response to allegations of abuse that promote both criminal and personal justice for children and families. In addition to our direct service training, Missouri KidsFirst strives to provide our child advocacy centers with administrative support, opportunities for leadership level professional development, and financial support to sustain the critical work of these centers. For those who aren't familiar with the role of a Child Advocacy Center in an investigation, CACs coordinate complex information gathering and sharing to minimize the number of times that a child must tell a painful story, and to ensure that each of the agencies involved in an investigation have all of the information that they need to properly evaluate their situation. CACs also uphold the integrity of evidence collection by ensuring that children are interviewed in an emotionally supportive and developmentally appropriate manner. Finally, CACs promote healing for children and families by offering victim advocacy that extends beyond the courtroom, as well as trauma-informed mental health care that can help a child feel whole again. As the state chapter of the National Children's Alliance, Missouri KidsFirst is always thinking about how we can help sustain these invaluable services through reliable resources and effective operations. Our bi-monthly network meetings and annual leadership retreat facilitate collaboration and connection between one of the closest knit statewide networks of child advocacy centers in the country. Our CAC network is also exceptional in its provision of services to every county in the state of Missouri. Where many states are still looking to incentivize new centers or expand the reach of existing ones to meet service gaps, Missouri KidsFirst helped to achieve statewide service provision back in the early 2000s and has since worked to maintain this accomplishment by monitoring, protecting, and distributing state and federal funds for Missouri's 15 regional CACs and advocating for increases where needed. Missouri KidsFirst also takes great pride in the exemplary leadership demonstrated by our members. Sadly, one of our beloved CAC directors, Kathy Carr, passed away this year back in February. Kathy was with the CAC of East Central Missouri for 13.5 years, starting out as a volunteer, then a family advocate, and ultimately served as the CAC's director. Kathy's supervisor, Cindy Vessel, provided a statement about Kathy that I'd like to share with you now. Cindy says, "I had the privilege of knowing Kathy since 2006. She started as a volunteer at various CAC events, and her passion to serve children became her job as she moved into a family advocate role at the CAC in August of 2006. Always wanting to grow and learn more, Kathy went back to school and earned her master's degree. In 2017, Kathy became the director of the CAC. Kathy was excited to reach the next level in her career. She had big plans, but as it often happens, life had other plans. In the fall of 2018, Kathy was diagnosed with an aggressive cancer. Throughout her cancer journey, Kathy's motto was to be stronger than the storm. She fought, and she fought hard. When we lost Kathy in February 2020, we lost a leader, a colleague, and a friend. The world lost a huge supporter in the fight against child abuse. Kathy is missed. A part of her will always be with the CAC. I feel the best way to honor Kathy is to remember how she served and how she fought. And on those dark days when you wonder if the work we're doing is making any difference, we feel defeated, we can pull from Kathy's strength and choose to be stronger than the storm." This year, Missouri KidsFirst is presenting Kathy Carr with a posthumous Standing with Children award to honor the passion, dedication, and resilience of this tremendous woman. If Kathy were here, we'd extend our most heartfelt gratitude to her for standing with Missouri's children and for giving so much of her precious life to others. I'd like to turn it over now to Rebecca Bax, Missouri KidsFirst Training and Education Manager, to talk about our medical response program.
Thank you, Jenny, for that moving tribute to Kathy and for further describing how Missouri KidsFirst empowers adults. As my colleague said, I'm Rebecca Bax. I'm the program manager for the Safe Care program with Missouri KidsFirst. I know you've heard a little bit about the Safe Care Network, but I wanted to give you a more comprehensive overview of the program. Safe Care is a state-funded program that develops and maintains a coordinated medical response to child abuse and neglect in Missouri. Through funding designated by the state legislature, administered by the Department of Health and Senior Services, Missouri KidsFirst and its partners accomplish the program's mission, which is to provide every abused child easy access to quality and compassionate medical care to ensure their health and safety through proper diagnosis and treatment. The Safe Care Network's Resource Center directors and child abuse pediatricians, Dr. James Anhurst with Children's Mercy Hospital, Dr. Adrian Ajamis with St. Louis Children's Hospital, and Dr. Tim Kutz with SSM Cardinal Glennon, direct activities of the network in cooperation with Missouri KidsFirst. Every maltreated child deserves access to quality medical care, Proper diagnosis and treatment is typically performed as a scheduled visit to a safe care provider at a child advocacy center or clinic in the child's community. Some safe care providers are available to respond to emergency departments or hospitals when medically necessary, or provide expert consultation and review of medical records if direct care of the child is not possible. The Safe Care Network is committed to ensuring that all children have access to quality medical examinations by offering numerous training opportunities for safe care providers, other medical providers, and non-medical professionals involved in the investigation and care of maltreated children. All safe care providers maintain ongoing education, peer review, mentorship requirements, and as safe care providers must be the leading medical experts to recognize, respond, refer, report, and reduce the incidences of child maltreatment in the state of Missouri. Safe care providers are physicians, physician assistants, and nurse practitioners that have successfully completed safe care training and have made the commitment to providing quality forensic evaluation to maltreated children in their communities. Providers encompass a wide range of experience, urban to rural, small practice, private practice, to large children's hospital. Each plays a valuable role in ensuring that Missouri's children have access and the best care possible. Safe care providers understand that their work does not end when the patient walks out the door. The care of maltreated children requires close collaboration with other agencies and institutions responsible for the health and safety of children. This involves producing a meaningful report, communicating with multidisciplinary team members, and testifying in court when necessary. I have the honor today of recognizing one of these incredible safe care providers who has dedicated a considerable amount of time to her work as a safe care provider. Our next awardee has provided high-level service to Missouri's children through her role as safe care provider. Her work in the field of child maltreatment for the last 19 years and as a member of the medical field for 42 years. Dr. Patricia Webb is an established expert in medical forensic examination of children. During this time, she has performed over 5,000 medical forensic exams and has offered expert court testimony too many times to count. Patricia has also made significant impact through authoring countless papers on child abuse and through training and mentoring other medical professionals. She is not only one-of-a-kind safe care provider, she is also a tremendous advocate for children and has worked to educate not only professionals, but also the community on the impact of child abuse. Patricia has been heard to say, "People often ask me how I do my job, and there are definitely tough days when I have to hold back the tears, but there are also joy in this journey." She says, "I am helping children and families heal and get the help they need." Patricia's colleagues had this to say about her: "We are so proud that Patricia is receiving the Standing with Children Achievement Award. She has truly selflessly devoted her whole career to supporting children who have been abused and neglected. Patricia's care and concern for every child has been evident to their families and our team. Her impact is far-reaching and goes beyond her medical practice. She has touched every child and every one of us with her big heart and kind nature, and that is always the best medicine. Thank you, Patricia, for being such an important part of the work of our CAC. We love you and miss you." Patricia, it is my honor to recognize you with the 2020 Missouri KidsFirst Standing with Children Award. Thank you for your service. Patricia, if you'd like to say anything now, I've unmuted you so you can go ahead.
Thank you so much, Rebecca. I'm here with my husband, Mark. My heart's just full of gratitude for these years I've been able to do this work. I remember back in the late 90s, I was working on my master's degree, and Kathy Crayley from Children's Mercy Hospital, a nurse practitioner, came and talked about working in the medical evaluation of child abuse. And it just stirred up my heart. And I just knew at that time, this is what I want to do for the rest of my career. And then in 2001, it was a privilege to work with Dr. Renee Walsh at Children's Mercy Hospital for 2 years before coming to Springfield, and it gave me a good solid foundation in the work. And there have been so many others. Along the way, I'm just grateful to to Barbara Brown Johnson at the Child Advocacy Center, and then Linda Saturno also, who've been a great support to me. And our child abuse pediatricians across the state. Dr. Tim Kutz has been just a fantastic mentor, and Dr. Ajamis, Dr. Anderson, all of them, and others have been accessible, easily accessible when we had questions or needed consultation. And this isn't any kind of work that you do in isolation. I don't feel like there's anything I have done, but we've done it as a team, and not just medical, but also our interviewers, our advocates, our law enforcement, children's division. We've all been a team. And I've been thinking over these past 19 years that I've been able to do this work, some things that we have accomplished. We have saved the lives of children. We have ended a cycle of abuse that have gone in generations, so that the next generation doesn't have to face child abuse. We have given hope back to children to have a normal and a healthy life. We've restored that hope to them. We've done our part to help perpetrators be removed from society so that other children are protected. But it's just been a privilege of mine to be in this work. I appreciate Missouri KidsFirst and all that you have done, and so at the end of this 19 years, I want to just say, keep up the good work, all of us. Keep up the good work. And thank you so much for this award. Thank you for this recognition. I really appreciate it.
Thank you, Patricia. You've done a wonderful job, and we appreciate all that you've done. I'm going to hand it off to our Executive Director, Joy Osterly, as she talks about more work that Missouri KidsFirst does.
While most Missourians are not child service professionals, all Missourians are members of communities in which children are the most vulnerable members. Protecting children from abuse, recognizing the signs of abuse, speaking up and taking action. All of these steps require us to exercise consciousness, choice, personal power, and relentless compassion. That's why Missouri KidsFirst works with adults throughout the state to provide the training and support they need to understand child abuse and to develop child protective behaviors that can prevent abuse from occurring. After all, it is one thing to say we want to protect kids. It's a very different thing to know how to do that and to do it. Missouri KidsFirst works every day to bridge the gap between wanting to be there for kids and knowing how best to do so. We've been implementing the One Evidence-Informed Child Sexual Abuse Prevention Program for over 15 years, and I'm happy to introduce Jenny Dodson-Weil to speak more about our prevention work.
Hello, my name is Jenny Dodson-Weil, and I am a child advocate. I wear this hat in many different ways. I have been an attorney that has represented school districts. I have worked at court-appointed special advocates where I trained guardians ad litem to speak for children in the foster care system. I've worked for nonprofits that have served children. I taught preschool briefly. And the most important role I have is that as a mother. And so I have felt compelled to work in the field of child sexual abuse prevention to honor all of these roles that I've played, but also because in finding the Stewards of Children program, which I'll talk about in a few minutes, I found a way to truly be able to make an impact on the behaviors and attitudes of adults in creating safer environments for children, environments where they will be protected. So I want to thank you for coming and listening today to the Standing with Children's Award Luncheon. And I want to thank you for your continued support of Missouri Kids First. I especially want to thank the Children's Trust Fund and the Dr. Bronner's Family Foundation for their contributions to the Stewards of Children Prevention program here at Missouri Kids First. Through the Stewards of Children training, the Missouri Stewards of Children Network, 60 authorized facilitators will train 5% of the adult population in every county and major city in the state of Missouri to identify, prevent, and react responsibly to child sexual abuse. We believe that once 5% of the adult population in any given community is trained, a tipping point will be reached where the 5 steps to protecting children will become the cultural norm. To date, over 18,000 Missouri adults have been trained in the child protective strategies presented in Stewards of Children. 2 counties, Reynolds and Carter, have reached that 5% tipping point, and several others, such as Iron, Barton, Madison, and McDonald, are moving closer. 88% of all Missouri counties have at least had 1 or more persons trained in Stewards of Children. As with many other aspects of life during the COVID-19 pandemic, we are adjusting to how we provide the Stewards of Children training. Currently, we are working on adapting with some online options that Darkness to Light has created for authorized facilitators. If you're interested in participating in the Stewards of Children training or some other specialized trainings, including one about helping children during the COVID-19 crisis, you can go to www.d2l.org for Darkness to Light's website and trainings. There's also a place on there you can enter in your zip code to see where there's a live training in your area. We want to thank you for joining us here today at the Standing with Children Award event. And thank you for your continued support of Missouri Kids First and the Stewards of Children Prevention Program. Thank you.
And thank you, Jenny Dodson-Wheel, for pre-recording that video for us. We are grateful to you. For the past 18 years, Missouri Kids First has successfully expanded our work from advocating for CACs to building a child abuse prevention network throughout the state. We are both the state chapter of the National Children's Alliance and Prevent Child Abuse America. Every day we work to build a Missouri, person by person, community by community, that will be safer for our children. We work for a world that is safe for children so that every child may develop his or her talents that leads to a flourishing life that every child deserves. We are thrilled to honor and work with the many advocates across the state who passionately care about improving the lives of Missouri's children. Certainly, our 3 recipients today, Representative David Wood, Dr. Patricia Webb, and Kathy Carr, are 3 very deserving recipients. As I've thought about these 3 individuals over the week as we've prepared for today's event, I have been brought to tears multiple times by the work that each of them has done to contribute to the well-being of children. Certainly, we look forward to working with Representative David Wood in the future, as well as Dr. Patricia Webb. We're so grateful for them and their ongoing support for Missouri Kids First and the well-being of children. And it's also very bittersweet that we remember Kathy Carr today for her life of service to children and the well-being of children. She was a treasure to work with, and she is missed every day. We hope you mark your calendars and plan to join us next year on April 26, 2021, when we will host the 2021 Standing with Children Luncheon again. And we won't be having peanut butter and jelly. Kids First, grateful for your presence, and we look forward to seeing and working with all of you in the days to come. Thank you, thank you, thank you.